Hey, everybody, this is Munson Steve. Welcome to Health IQ. You know, for all of you out there and thinking about an HBCU and thinking about Sisters with Superpowers who've created this phenomenal movement of HBCUs, I found one for you. And she is right here. She is truly a person that has created a safe space with benefits for all of us. And I'd like to take this time to introduce you to Dr. Williams. She is a whole MD. Welcome to Health IQ. How are you?
I'm fine. I'm fine. Thank you for having me. I'm glad to be here.
When you were a freshman in college, did you imagine or see yourself as a doctor then? Did you see yourself in the white coat?
I did. I did. That was my goal. And so I saw myself in a white coat. I didn't have any family members in the white coat, but I wanted to be the first. So here I am.
So, in setting goals like that and being a trusted member of the community, why did you have that burning desire to be a Black physician for a community, in the South? Ooh.
Yeah. So, there weren't many of us, and still today, there aren't many African American physicians. And so I wanted to make a difference in our communities and show other people, other kids, and that it's something that you can do. Just coming from, the regular neighborhood, you can aspire to be whatever you want to be. And so I didn't let that deter me from my dreams and goals. I pushed forward. And so that was a major driving force for me.
Xavier, going to an HBCU, and obviously I graduated from Morehouse. So, what is that feeling that you had when you were going and you were in your chemistry class and you were there with professors? Name one professor that kind of made you think about and kind of met and did a mind melt on you achieving your goal at the HBCU, Xavier.
So we had several, outstanding professors at Xavier University, one of the top universities to put African Americans into medical school. And so one that stands out to me was Dr. Labat. He was our zoology instructor, and he was pretty stern. Like, he would make sure that you didn't just memorize the information, you learned the information. And he just instilled that drive, that ethic, that work ethic, that this was important, and so he really stands out. There's so many that stand out to me, but I just remember him putting that ethic into you, because you can learn, you can make the grade, but if you don't have that work ethic, that makes the difference, because you can get the job, but can you keep the job, right? And so that was something that he instilled in me. And the test that he had, it was more about application and not memorization. And so that's what medicine is all about, applying the information that we learn.
So you end up at LSU,
I end up at
medical
LSU.
school, and now you're definitely not at a HBCU,
Definitely.
and you've got to represent a whole nation, Black nation of medical school, all alone, and you're a female.
Mm-hmm.
What was that like, and what would you share with any other young Black woman who really is going to have to follow in that trail as it relates to being a giant amongst people that are doubters or are not anticipating or don't even know someone like you?
So going into that environment, finishing up from a HBCU was something that I would say was somewhat challenging. However, I knew it would be, so I started that transition before even leaving Xavier. And so I worked at LSU throughout my undergraduate career in one of the research labs. So I started building relationships and I started to learn the culture and learn how to navigate in that space. So I would definitely recommend, getting your foot in the door, networking, trying to figure out how they do what they do in those other institutions, and also having that support system, having other people that look like you to support you, looking at certain professors who look like you to support you, because that is very key in navigating that space. So those are two things that I would say, first of all, plan, start to learn the culture, start to learn the environment. I recommend to a lot of students and people that I mentor in the undergraduate setting that they should start to do like summer programs, summer internships at those or at those universities where they're looking to continue their education in professional school.
I love that. I think that being able to understand and have insight that you shared, but research is so important for the Black community, particularly health research. And obviously, COVID made everybody pause based on what our understanding and truly not even connecting Tuskegee to research, because that was not a research project in the sense of COVID. But what have we learned about the role research and the vaccine development, if you would lean into that a little bit, for those who can kind of get a glimpse of someone like yourself who's been in the research area so that we can be confident in the vaccines that we're receiving?
So research is so important in just in general as it relates to the healthcare field and even in our own social and economic areas of life. Research makes a difference in how we do what we do and how decisions are made. And so in policy, as it relates to medicine, as it relates to everyday life, and social determinants of health, all of those things are impacted by research. And so, like I said earlier, I worked in research before I went to medical school. I worked in pulmonary critical care at LSU. So I did a lot of bench research. And so research makes the difference. So we learn about the mechanisms, we learn about how things work through research and how to better translate that into practice, into the practice of medicine. So research is so important. And in the African American community, we have been, I guess we have a hesitancy as it relates to research because of unethical practices of the past. And so I think that hinders us in being involved so we can have better outcomes in our health. And so I think research has played a vital role, especially in the development of the vaccine for COVID-19. The research that had been done prior to COVID-19, which is, we were doing research on the type of vaccine that we have for the COVID-19 vaccine, the mRNA vaccines were being done prior to COVID-19. So we understand this is not a new type of vaccine. This is something that has been studied in the past.
So you're involved in the community, you're in outreach, you're a trusted voice. Why get a vaccine? And for those who have gotten 1, 2, and now don't want to get a booster, what are they missing?
So vaccines help to prevent severe disease. It helps to prevent hospitalizations and death from COVID. And being boosted offers more protection, the most protection. Unvaccinated people are 9 times more likely to be hospitalized from COVID-19 than people who are vaccinated. So vaccines help prevent severe disease. And so that is the reason to be vaccinated. It helps to prevent us from getting more severe disease, because we know, and I'm sure everyone listening knows, that the Black community, African American community, we have been disproportionately affected by COVID-19. And a lot of that has to do with us having a lot of underlying conditions that are uncontrolled, like diabetes, like hypertension. And those things play a part in these poorer outcomes as it relates to COVID-19. So the vaccines actually help in that, in preventing severe disease.
When you were first hearing about this, and you literally, there was no vaccine. Mm-hmm. As a trusted frontline delivering what did you see that you had never seen before as a Black physician?
Well, those times were very difficult. You saw people who were just, they couldn't breathe. It kind of, if I can kind of say, it's like you have a pillow over your face and you can't catch your breath. And to see people go through that, and to see people die in a hospital without their loved ones near them. People who were quote unquote healthy, not 70s, 80s, although we had most of the deaths, a lot of the deaths were in older people, but a lot of people were not. And so to see those things happen, and because of COVID-19, when they could still be here today if it wasn't for COVID-19 necessarily. I don't know that, but those, to see that and to see the healthcare professionals be overwhelmed, just overwhelmed with patients. And just we were concerned about bringing it home to our families, so it was it was a trying time, and not knowing if we would have a vaccine to help decrease the transmission of this virus. So it really was a fearful time back in early 2020.
And so you got a vaccines created, and now you have the ability to at least reduce the severity, and you have a community that still is not certain or uncertain. How does that make you feel, given that you have done and been a part of research, and you now are there in the community working to heal them, and they're not certain, but then you see them in the emergency room? What do you say? Because then you can't give them the shot.
Right. So, I say this. I know everyone has their own level of understanding about the virus. And to be honest, things have changed, a lot as it relates to the recommendations, the information. It's a lot of misinformation. And so you can't, I can't get upset, or you can't, you have to understand and be compassionate about people being hesitant or not really fully understanding what's going on, because there's so many different messages sometimes. Things are changing. And if I might comment about the changes and recommendations, the changes that we hear over the media, we're learning, when I say we, the medical community, the scientific community, we are learning about this virus in real time. We're learning about this virus as everyone is learning together, right? And so things change as the virus change. We have variants. And when the variants change, the recommendations change. This virus is mutating. So the initial COVID-19 virus is not the same as the one we have that's most prevalent now, which is Omicron. So as things change, the recommendations change, the conversation changes. So with all of that being said, I can understand why people may be hesitant. And on top of that, the Black community even more hesitant because of the unethical practices of the past. So I have to be compassionate about that, but I also ask people to open up their hearts and minds to listen to those they trust about what's really going on with the virus, with the vaccines, with the boosters, because we all have to get on the same page. This pandemic is a public health issue. So we all have to work together to get this under control. It can't be that some do and some don't. We all have to work together to help get this virus under control. And the way to do that is to get vaccinated.
So when you're there and the person's asking you, Doc, should I really get the booster? And they have a straight face. Mm-hmm. What are you thinking when they ask you that question, given that they've had shot 1 and 2? And then what do you explain to them about why they need to go ahead and get the booster and bring their family to, begin to get vaccinated?
So what I explained to them is this: the booster adds additional protection against getting severe disease, hospitalization, or death from COVID. The vaccine does not necessarily it's not that you won't get the virus, but it helps to protect you from getting severe disease or hospitalization. And I sometimes say, it's kind of like wearing a seatbelt. We all wear a seatbelt. It doesn't mean you won't get into an accident, but it will potentially protect you from, having, getting injured more severely if you're in an accident. So I say to them that the vaccine, the booster is more protective. Getting the initial 2 doses of the vaccine, you increase your immunity against the virus. But we don't know as a medical community how long those antibodies will protect you from the initial series, right? And so getting boosted increases your immunity again, just like we get a flu shot every year because the variant of the flu changes. So the booster increases that immunity and that protection.
What's it feel like now that you've been in going on 2 years plus with COVID as a trusted partner and literally involved in the community? How do you feel? Do you still see that young lady who knew when she walked in Xavier that she was ready to serve this community? And how does it make you feel when you look in the eyes of those young girls that you serve, and obviously young boys, but in all the community? But when you see one of them knowing that they can now reflect and look at you, what's it like delivering that service during this moment that they really are trying to make sure they're making the right decision, getting their family and their children, and trust you as a trusted partner in their life?
That, it feels, sometimes it's a heavy weight because you want to make sure you're doing the right thing for the people in your community, but it is such a rewarding weight because I feel that I can make a difference, and I feel honored to be able to be there, to be someone that you know, looks like the people that I'm seeing and taking care of sometimes, that they feel like they can be maybe like me, not that I'm all of that grand or anything like that, but it is an honor and a privilege and a pleasure to be able to influence or be able to be a mentor, or just to share some important information to someone that that I feel that they trust what I'm saying, and I try to do my best to give them the information in a way in which they can understand it.
So when you're there as we close out, and as you're doing outreach today, and you're talking to that family who has to think about their children getting vaccinated, particularly children over 5, what are you sharing with that mom or dad who literally has to make this decision, and thinking about, will it affect the child's reproduction? Will it affect the child's growth? What do we say? And will they not be able to have kids? Have we had any babies during COVID? People that have got vaccinated?
Yeah, we've had a lot of babies during COVID. Yes, we've had a lot of babies being born during COVID. Research has not shown that the COVID-19 vaccine has any effect on fertility at all. And actually, it's recommended for pregnant women to be vaccinated. There are more severe illness if you have COVID and you're pregnant and you're not, than if you do. And so for my parents, for my patients, I recommend that all of my patients age 5 and older be vaccinated. Kids They don't always want to wear their mask correctly. So it's a lot of transmission in schools now since, Omicron is so transmissible. I recommend that they get vaccinated. I recommend that they ask questions, seek their healthcare provider to make sure that they are eligible for the vaccine. And most importantly, go to trusted sources if they have questions, not, untrusted sources, but talk to their providers about the vaccine, about COVID-19. And so, it's very important for them to be vaccinated.
Well, you heard it first here on Rolling Out Health IQ. Of course, I'm talking about the sister with superpowers, Dr. Williams. Thank you so much for coming on and sharing and giving insight and the journey, obviously, that has built this empire. Never shrink. We really can't get enough Black doctors. There aren't enough. So thank you for even still being on the battlefield and giving us the love and compassion and empathy that you mentioned to our community.
Thank you. Thank you for having me. I don't know if I can mention our health fair that's coming up.
Yeah.
So the Stay Well New Orleans Community Health Fair and vaccine event will be on Saturday, January 29th from 10 a.m. to 2 p.m. at LB Landry High School. It will be a drive-through vaccination event for children 5 years and up, and also for adults. We'll have health resources, panel discussions from trusted Black healthcare professionals in the community. And if you're interested in learning more about the community health fair, you can visit staywellcommunityhealthfairs.org.
You heard it first. You heard me? We're going to be about it right here on the whole New Orleans. Go out, be safe, get vaccinated. We want to thank again Dr. Williams. You did an excellent job. We really appreciate you. Give us your love, empathy, and professional trusted insight to our community here on Health IQ. I'm Munson Steve. We'll see you real soon. Thanks, Dr. Williams.
Thank you.